Have you ever noticed that as you get older, certain things about your body just don't feel the same anymore? One of those things might be how you experience pleasure. For many men over 60, what used to feel natural and pleasurable can now lead to discomfort and confusion. But don't worry, this is not dysfunction. This is biology. In this video, we're going to explore how aging changes your body, particularly in the realm of self-care, and how to adjust your habits so you can continue to enjoy a healthy and fulfilling life. If you're feeling confused, frustrated, or even a little bit embarrassed about these changes, stick with us. We're going to clear things up and give you practical, actionable advice. Let's dive in. As men age, the body goes through a series of changes that can affect sexual health, including changes in circulation, hormone levels, and nerve sensitivity. These changes, however, do not have to lead to poor health or a reduced quality of life. The issue arises when old habits and routines, those formed in youth, no longer suit the body's new needs. This video is aimed at helping men over 60 understand how their bodies are evolving and how they can adjust their habits to maintain both safety and pleasure in their self-care routine. We'll go through some common mistakes, provide practical solutions, and discuss when it might be time to consult a doctor. As we age, several physiological changes occur, especially after the age of 60. These changes directly impact sexual health and self-care routines. Here are some of the key factors. Testosterone levels. Testosterone, the primary hormone responsible for libido and sexual function, naturally declines with age. This can result in a decrease in spontaneous desire and can affect overall mood and performance. However, this doesn't mean desire disappears altogether. It just becomes less frequent or spontaneous. Blood flow. The small blood vessels that support erectile function become less elastic and efficient over time. This means that achieving and maintaining an erection can take longer and may not feel as firm as before. Nerve sensitivity. As we age, the nerve endings responsible for sexual sensations can become less responsive. This leads to a dulled or muted sensation, which can affect both arousal and overall enjoyment during self-care. These changes are completely natural, but they can make older men feel like something is wrong with them when their body no longer responds the way it used to. The truth is that this isn't dysfunction, it's just biology at work. But understanding these changes is key to adapting your habits to maintain a healthy, satisfying sexual life. The silent mistakes. Many men over 60 are unaware of the subtle changes in their bodies and continue using the same techniques that worked for them in their younger years. However, these old habits can actually work against their health. Let's look at the 5 common mistakes older men make in their self-care routine and how to correct them. Mistake number 1, using the same grip strength. As men age, the skin on the penis naturally becomes thinner and more sensitive to friction. What once felt pleasurable in youth, a firm, strong grip, can now lead to irritation, desensitization, and even long-term damage to small blood vessels. A too tight hold puts excessive pressure on delicate tissue, reducing sensitivity and hindering the ability to fully enjoy the experience. Solution: loosen your grip. A gentler, more relaxed hold reduces unnecessary friction and allows for heightened sensitivity. This adjustment can lead to a more enjoyable and pleasurable experience, as it allows the body to respond to touch more effectively. The goal isn't to apply force, but rather to focus on sensation and pleasure. Experiment with lighter pressure and find what feels best for your body at this stage in life. By doing so, you'll ensure that your self-care is both safe and satisfying. Mistake number 2, going too fast. As we age, the nervous system naturally slows down, and the body takes longer to process sensations. quick, forceful movements that once felt enjoyable may now be overwhelming or leave you feeling unsatisfied. When you move too fast, your brain may not register the sensations in time, which can diminish the overall pleasure. Solution: slow down. Shift to steady, rhythmic movements that give your body time to fully process the sensations. This approach allows your nervous system to catch up and respond more effectively. Think of it like tuning a radio to the right frequency. If you rush, the signal gets distorted. But with patience, you can dial in the perfect rhythm for a more fulfilling experience. Taking your time not only enhances pleasure, but also helps you connect more deeply with your body and its current needs. Mistake number 3: skipping lubrication. As men age, testosterone levels naturally decline, which also affects the body's ability to produce natural lubrication. This reduction can make friction feel uncomfortable or even painful, leading to irritation, soreness, and potential injury. Many men may not realize that the same level of lubrication they once relied on is no longer sufficient, leading to unnecessary discomfort during self-care. Solution: always apply a gentle, unscented water-based lubricant before you begin. Lubricant not only reduces friction, but also creates a smoother, more comfortable experience, allowing you to enjoy the process without discomfort. By using lubricant early on, you're helping your skin respond better to touch, reducing the risk of irritation and enhancing overall sensitivity. This simple step is key to ensuring that your self-care routine is both safe and pleasurable, especially as your body changes with age. Mistake number 4: forcing yourself to climax. As men age, there can be a tendency to feel pressure to reach a climax quickly, especially if it's no longer as easy as it once was. This pressure can create stress, which actually suppresses the pleasure response and leads to frustration. When you focus solely on reaching the finish line, the overall experience becomes less enjoyable and more like a task. Solution: relax and embrace a slower pace. Instead of forcing yourself to reach a climax, let the experience unfold naturally. Enjoy each moment without the pressure of achieving an outcome. If you feel satisfied before climax, that's perfectly okay. The goal is to enjoy the journey, not rush to the end. By focusing on the pleasure of the process, you'll find that self-care can be more fulfilling and less stressful, ultimately leading to a deeper connection with your body and your experience. Mistake number 5: ignoring your body's signals. As men age, it's common to fall into familiar routines, often ignoring the body's subtle signals. If something feels uncomfortable or doesn't bring pleasure, continuing without adjustment can lead to irritation or even injury. Over time, these small signs of discomfort can build up, affecting overall well-being. Solution: pay close attention to your body. If something doesn't feel right, don't push through it, stop, or make adjustments as needed. Self-care is not about following a set routine or performing for an outcome. It's about listening and connecting with your body. When you focus on your body's cues, you can make the necessary changes to enhance comfort and pleasure. By being mindful of these signals, you create a more enjoyable and safe experience, ensuring that self-care remains both pleasurable and healthy. Creating a healthier self-touch routine after 60. As we age, maintaining a healthy and satisfying self-care routine becomes increasingly important for overall well-being. At 60 and beyond, it's essential to approach self-touch with patience, mindfulness, and an openness to change. With the body undergoing natural shifts in sensitivity, blood flow, and hormone levels, adjusting your routine can help ensure that the experience remains enjoyable and beneficial for both your physical and mental health. Here's a step-by-step guide to creating a healthier self-touch routine that's tailored to the needs of your evolving body. 1. Choose the right moment. Self-care isn't something to rush through, especially as you age. Choose a time when you can fully relax without distractions. Set aside 15 to 20 minutes of uninterrupted time, ensuring you won't be disturbed. The goal is to create an atmosphere of calm where you can focus entirely on your body's sensations. Avoid trying to squeeze it into a busy schedule or rush through the process. Taking time to honor your body is key to a fulfilling experience. 2. Set the environment. Your environment plays a significant role in how you experience pleasure. To create the ideal setting, consider soft lighting, calming music, or even a comfortable chair or bed that supports your posture. A relaxed, peaceful atmosphere signals to your body that it's time to unwind and tune in to the present moment. Comfort is paramount, as it helps your nervous system feel safe and encourages relaxation, which is essential for heightened sensitivity and enjoyment. 3. Focus on your breathing. Before touching anything, take 5 slow, deep breaths to settle your mind and body. Breathing deeply helps activate the parasympathetic nervous system, promoting relaxation and reducing stress. Slow, intentional breathing allows you to be more present with your body, helping you become more attuned to sensations as they arise. By focusing on each breath, you signal to your body that there is no rush. This time is for you to enjoy the process. 4. Apply lubricant early. As testosterone naturally declines with age, lubrication becomes an essential part of a healthy self-care routine. Applying a gentle, unscented, water-based lubricant before you start can significantly enhance comfort and enjoyment. Lubricant helps reduce friction, allowing your skin to respond better to touch and minimizing the risk of irritation or discomfort. Don't treat lubrication as an afterthought. Make it an integral part of your routine from the beginning, ensuring the process is smooth and pleasurable from start to finish. 5. Explore slowly. One of the most important adjustments as you age is to slow down. Begin by experimenting with different hand positions, angles, and rhythms. Don't rush straight into the most sensitive areas. Think of self-touch as a gentle exploration, not a goal-oriented process. Try using lighter pressure, focusing on how your body feels rather than rushing toward a climax. As your nervous system takes longer to process sensations, slowing down and allowing yourself to fully experience each moment will lead to greater pleasure and a deeper connection with your body. 6. Pause when needed. If you feel your arousal start to fade, don't panic. It's completely normal for desire to come in waves, and trying to force yourself to climax can lead to frustration. The goal is not to perform, but to enjoy the experience. If you need to take a break, that's perfectly fine. This is about honoring your body's natural rhythms. Whether you decide to continue later or just enjoy the moment for what it is, give yourself permission to pause when needed without guilt. 7. Breathe throughout. Consistent breathing throughout your self-care routine is essential to staying relaxed and maintaining blood flow. Deep, steady breathing keeps you in tune with your body and helps reduce any tension or stress that might arise. This is key to ensuring you remain focused on sensation rather than pushing yourself toward an outcome. As you breathe, you help your body stay relaxed and receptive to the pleasure that is unfolding, allowing for a more satisfying and mindful experience. After 60, self-touch is less about physical pleasure and more about reconnecting with your body and mind. It's important to let go of old expectations. The pressure to reach climax or replicate past experiences can make self-care feel like a task. Instead, let it become a mindful practice. As you adapt to these changes, you may find that the pleasure becomes deeper and more fulfilling, even if it doesn't look the same as it once did. This is a new phase of life, one that deserves its own approach, full of self-compassion. When to seek medical help. While most changes after 60 are natural, some may indicate that your body needs extra attention. Here are 4 signs that it may be time to consult with a urologist. Pain or discomfort. Persistent discomfort, even with gentler techniques, could signal inflammation or irritation that needs attention. Sudden numbness. If you notice a sudden decrease in sensation, it might be time for an evaluation to rule out nerve issues. Inability to achieve or maintain an erection. If you struggle to get or maintain an erection despite comfort and relaxation, this may be a vascular or hormonal issue that requires professional guidance. Emotional distress. If self-care is causing emotional discomfort or anxiety, it's important to talk to a doctor. Mental health and physical health are deeply connected. Self-care after 60 doesn't have to be about going back to the way things used to be. It's about adapting to the changes in your body with grace and awareness. With the right approach, you can enjoy a fulfilling, pleasurable experience that honors your body's needs. If you found this video helpful, don't forget to like, subscribe, and share it with others who might benefit. And stay tuned for our next video, where we'll dive deeper into how self-care after 60 can impact prostate health and what you can do to protect it. Stay informed, stay proactive, and take care of your health. You deserve it.